And a very good afternoon, goeiemiddag Molweni. You are still tuned into Sakhisizwe Building the Nation, Boudienasie. And that was the sounds by Checho featuring Shakaina called My Favorite Song. And the one before that was Mary Chan with Everything I Wanted. So right now we'll go into our first interview for today. So again, a very good afternoon, goeiemiddag Molweni. And like I've said, you are listening to Sakhisizwe Building the Nation, Boudienasie. So right now it is time for our interview with Nurse Nthabiseng, who is a clinical by profession, a motivational speaker, and also currently studying clinical psychology at the University of South Africa. And she will be speaking to us a little bit more about something very interesting called pregnancy that basically affects around 1 in 100 pregnancies. As much as it is rare, it is said to be a life-threatening and pregnancy that we are going to be talking a little bit more about. So it is called Ectopic Pregnancy, and Nurse Nthabiseng will be explaining to us a little bit more about what ectopic pregnancy is. So good afternoon. How are you today?
Afternoon, how are you? I'm very fine, thanks.
I can't complain at all. So, Nthabiseng, if you can just firstly start by giving us a little bit more information around what ectopic pregnancy is, as it is very rare. And so tell us a little bit more about that.
Okay, let me just first say that I'm not a nurse, I'm a clinician, but it's fine. So when we talk about ectopic pregnancy, it's a pregnancy that actually implants outside the uterus. You know, with the normal pregnancy, the egg is fertilized and it moves through the fallopian tubes and it implants inside the uterus. So with this pregnancy, it either implants on the abdomen or on the fallopian tubes. That's actually what ectopic pregnancy is.
Okay, so what would be the main causes of ectopic pregnancy?
With the causes, we actually dwell more on the risk factors because we can't say this caused ectopic pregnancy, but it actually is affected by risk factors. I don't know if I should go through that with you guys.
We will get a little bit throughout the interview. We'll get a little bit more information on that. So let's say, for instance, you are pregnant. So how soon will you know that you do have ectopic pregnancy?
Okay, so you remember, like I said, the pregnancy grows inside the uterus. So if it's not the uterus, the symptoms will appear faster. So what happens is, the pregnancy grows and it enlarges. So if it's in the fallopian tube, as soon as 7 weeks up to 11 weeks, you'll start experiencing the symptoms because now the pregnancy is growing, and where it's growing, it's not a comfortable place for it.
So what is the options of the woman that's pregnant at that point?
So the only option for ectopic pregnancy is to terminate the pregnancy. So there's no way an ectopic pregnancy can actually give you a live baby.
Okay, no, I do understand. And let's say, so is that the reason why it is important also for women that are pregnant to book early so that they can basically pick up on this?
Yes, that is what we actually encourage, because if you book early, we are able to tell you about the symptoms that you may actually experience for us to exclude if it's ectopic pregnancy or not.
And what happens in a situation whereby, let's say, this has occurred, but you maybe don't know, because it does happen sometimes where the female tend to not know that they are pregnant. So let's say they go book off the 4 or 5 months, and then it gets discovered, but your pregnancy is ectopic. What happens in such a situation?
Okay, let me first just say that an ectopic pregnancy will not go above 3 months. It will not grow above 3 months. So by at least 11 weeks, the symptoms that it's ectopic, they will actually appear, because once the pregnancy starts growing, the place that is at has to enlarge. So if it's in the abdomen or the fallopian tubes, there has to be symptoms that there's something wrong. So it will not go above 3 months.
Okay, so the woman will discover then by themselves that you are pregnant or you need to get to a hospital or something like that. So that would be the indicator. And then can ectopic pregnancy, like when you have been diagnosed with ectopic pregnancy, like you've mentioned, it needs to be terminated. Is there no treatment that is available that can assist with this? Does it need to be terminated?
It has to be terminated. Remember, like once, let's say the pregnancy is in the fallopian tube, there is no way for us to actually drag the pregnancy out of the fallopian tube to the uterus. It has to be terminated, whether by giving you a medication that will stop the cells of the pregnancy to grow, or by giving you surgery. Those are the only 2 options that we have. But for the medication one, it has to be given earlier. So 4 weeks and less, you need to know you are pregnant, and we act then, because above that, then it needs surgery.
Okay, and then just a few questions that listeners wants to know. So, are there any any ways that ectopic pregnancy can be prevented or avoided?
There's no way, except for, like I was saying, once you get to the risk factors, you'll understand why we actually need to go there. Because once you know the risk factors, you can actually try and avoid some of the things that will make you to have ectopic pregnancy. For instance, smoking. Smoking is one of the risk factors that will actually cause ectopic pregnancy. For you having multiple partners or recurrent STIs is one of the things that you need to actually avoid doing in order for you not to have ectopic pregnancy. But otherwise, anyone can get ectopic pregnancy.
And you are still tuned into Sakhisizwe Building the Nation, Boudienasie, and we are speaking to Nthabiseng, and she's just been telling us or speaking a little bit more about ectopic pregnancy and what it is. So do engage with us, 061-862-1065, if there's any questions you would like to know around ectopic pregnancy. And another question that came through, so, hi Jasmine, can I ask if whether it is possible to get a normal pregnancy after a person has had ectopic pregnancy?
Oh yes, it is very much possible. We have had women who've had ectopic pregnancies and they end up having babies. So the thing here is, if you have one ectopic on the right fallopian tube, the left fallopian tube is still working, so it can still give you babies, you know. The only problem is if you have ectopics on both the fallopian tubes, then we need to cut both of them. Then that's the only way you can have babies. Otherwise, if it's just one tube, the other one can still make you babies.
So with that said, so can it be removed after the pregnancy has been terminated, or is it there for life?
So what happens during surgery is where the baby has implanted, especially on the fallopian tube, remember again, it depends how far the pregnancy was. So if the pregnancy was, let's say, 11 weeks, that tube is totally destroyed, because, you know, the baby will now be fully in the tube. So we need to cut and then we tie. That's when the tube is destroyed. It is not working. But if it's, let's say, 7 weeks and the baby was still small, they cut and repair. So even that tube can still be saved if the pregnancy was still in early ages. So they can cut and repair, and then you'll be able to make babies on the same tube if it was still early stages of the pregnancy.
Okay, this truly sounds very interesting and also complicated at the same time. So another question that came through is, good afternoon, Jasmine and Nthabiseng. Like, what is the difference between a miscarriage and an ectopic pregnancy? As you've explained already what an ectopic pregnancy is, maybe you can give the definition of what it means to have a miscarriage.
Okay, the difference between these two is you are both losing, like in both instances, you are losing the child. But with miscarriage, there is no surgery involved, and sometimes you don't even know that you were pregnant. So you just see bleeding or the abdominal cramps, and then we actually give you treatment to to remove the baby inside your body. And then with ectopic pregnancy, there is surgery. Then that's where we have to, remove through surgery and everything, theaters. But with miscarriage, you just bleed and the baby, goes out without any surgery being done on you.
Yeah. Okay, and then I know we've spoken about this, but also maybe this listener is just tuned in now. So can an ectopic pregnancy happen because of the different sex positions that cause the sperm not being able to travel properly to the uterus?
There's no, study done on that. So I can't comment and say it can or cannot. But what I know is once a man ejaculates inside of you, it does not matter which position you are in. If you are meant to fall pregnant, you'll just fall pregnant without you even doing any position to help the sperm channel its way to, if you're just pregnant, you fall pregnant even without doing any sex position specifically.
And then Nthabiseng, people that are currently tuned in, that maybe just tuned in right now, that wants to know a little bit more information around this, like what would your advice be to that individual to take better care of themselves when it comes to ectopic pregnancy? And like you've mentioned, early detections is the best cure in this situation.
So first of all, I want everyone to know that ectopic pregnancy can happen to anyone. Previously we were saying if you are above 35 and whatnot, but these days, even people as young as 21, they have ectopic pregnancy. So what you need to do is once you suspect that you are pregnant, do the pregnancy test and then you monitor the signs. If you see that you are having abdominal pains that you do not understand, especially if they are focused on one side, radiating to the shoulder, just go to the clinic for testing. If you see that you are bleeding vaginally, go to as long as you are pregnant, anything that is abnormal, just go to the clinic. They will check and refer you for further, investigation if you have ectopic pregnancy or not. Because like you said, it's life-threatening and it will not wait for you to, check and see if it is ectopic or not. Just go. If it's not that, they will send you home, but at least you will know that you are safe.
And Nthabiseng, as we all know that our public healthcare facility, most of them are under resources. So would it be wise for you to ask your gynae or the doctor that is assisting you in that process to ask them to check for ectopic pregnancy?
You can do that because besides you being done a scan, ectopic pregnancy can be diagnosed, with the examination that we do in the room that we actually do. So the scan is just the confirmation to say, this is what I found while I was doing the examination. Now let's confirm what I suspect. So you can just ask them to do the examination. Believe you me, whatever we do there, we know that there's an ectopic without even going for the scan. The scan is just for confirmation.
And like you've mentioned, people or women that are at risk is as young as 31 already, so there's no really age that can be associated with ectopic pregnancy.
Yes, exactly.
Okay, then if people want to know further information, like you do education on your portfolios and so forth. So if they want to know a little bit more about the different kinds of illnesses and infections to better protect themselves and equip themselves, especially as a young mother, as you know, teen pregnancy is very high in our country. So when it comes to ectopic pregnancy, to know a little bit more about that, like where can they go on social media and so forth?
So I do ask them to email me if they are free. So that is Nthabiseng Mduli, 9@gmail.com. They can ask me any question. I do answer them. And then I have a TikTok page, which is, _Thubelihle_. So if you just search Thubelihle on Nthabiseng, the charismatic clinician on TikTok, you will get me there. Also on YouTube, it's the same. So they can just email me and just, bear with me because I get a lot of emails, but I do answer them when I get time.
And then how common is this, just before I let you go?
It's very common, believe you me. I myself also had one. So I'm not 35 and above, but it's so common. And these days it's even worse.
And there's no type of foods that you need to avoid in order to prevent this or anything like this. It just happens. It's just, is it genetically affected or so?
It's not even genetic. You can have ectopic pregnancy and be the first one in your family. Like it just happens. Like I said, you know what the main problem is here? let me just say the cause. Because once the egg is fertilized, it has to move through the fallopian tube. So inside the fallopian tubes, there are hair-like structures which are called villi. So their job is to, move side to side in order to help the egg, the fertilized egg, to implant. So if those villi do not move like they are supposed to move, then the egg will implant inside the fallopian tube. So that one can be caused by, anything under the sun for the villi not to work. It can be the medication. It can be, spontaneous. So, there's no specific cause to say this is what has caused it. That's why anyone actually can get ectopic pregnancy. There's no specific thing that we can say, avoid this one. Definitely you will not get it. It just happens to anyone.
Thank you very much, Nthabiseng, for taking the time to speak to us today. This was truly a really interesting conversation, and I've also learned a lot about ectopic pregnancy. And like you've mentioned, it is the only cure at this point is to get early diagnosis. So once you become pregnant, to go get yourself tested and checked out in order to avoid further threatening, because like you've mentioned, this is life-threatening. So early detection is the best option at this point. So,
yes, ma'am.
So thank you very much for taking the time to speak to us today. Are there any additional words in closing?
Yeah, I just want to let everyone know that sometimes ectopic will not give you pains in the abdomen like the classical symptoms. If you faint or you feel weak or you feel dizzy, just run to the clinics. I know it's usually full and whatsoever, but with people who have symptoms relating to ectopic, they are always an emergency. So you will not get to the clinic and say, I have abdominal pain or I'm bleeding, and they tell you to wait on the line. This is an emergency and it's life-threatening if it's not attended urgently. So I just want everyone to have faith in the health system. I know it's very hard, but they should just trust the process, and we will do anything we can and everything we can to actually make them healthy again and save their lives.
Thank you very much for that advice. So thank you very much for taking the time to educate us a little bit more on ectopic pregnancy. And like you've mentioned, the best way if people want more information is to go via your socials and convey those socials again.
It's Nthabiseng Mduli, the charismatic clinicians, on YouTube and also on TikTok. Then there's Nthabiseng Mduli, 9@gmail.com for emails.
Excellent stuff. Thank you very much, Nthabiseng, taking the time to speak to us today. Have a marvelous day further. Bye.
Thank you. Bye.
And there you have it. So that was a little bit more on ectopic pregnancy and what it is and how dangerous it is. So within the first 7 weeks, it is critical that you do get yourself to a hospital if you are suffering from ectopic pregnancy.